Hi and welcome to our YouTube channel. Today we're going to be talking about hypertension, or high blood pressure. Hypertension is a medical condition in which the pressure of the blood flowing through your arteries is consistently too high. It's important to have your blood pressure checked regularly because if left untreated, hypertension can lead to serious health problems. So, what are the complications of hypertension? High blood pressure can increase your risk of developing heart disease, stroke, and kidney disease. It can also lead to damage to your arteries and other organs. What causes hypertension? There are a variety of factors that can contribute to high blood pressure, including unhealthy lifestyle habits such as being overweight, poor diet like eating too much salt and not enough fruits and vegetables, lack of exercise, excessive alcohol and tobacco use. Medical conditions such as diabetes and kidney disease can also cause hypertension, as can certain medications such as corticosteroids and NSAIDs. So, how is hypertension diagnosed? Your doctor will take readings of your blood pressure at different times to determine if it is consistently too high. Blood pressure is measured with a device called a sphygmomanometer, which consists of an inflatable cuff, a gauge, and a stethoscope. The cuff is placed around your upper arm, and a healthcare provider listens to your blood flow through the stethoscope as the cuff is inflated. The gauge measures the pressure of the cuff. Blood pressure measurement is given in two numbers, systolic and diastolic. The systolic pressure is the higher number and reflects the pressure in your arteries when your heart is contracting and pumping blood. The diastolic pressure is the lower number and reflects the pressure in your arteries when your heart is resting between beats. According to the American Heart Association, the current diagnostic criteria for hypertension are as follows. Normal blood pressure is less than 120/80 mmHg. Elevated blood pressure is 121/29 less than 80 mmHg. Stage 1 hypertension is 130/139/80/89 mmHg. Stage 2 hypertension is 140/90 mmHg or higher. It's important to note that these criteria apply to most adults, but may be different for certain groups of people, such as those with diabetes or chronic kidney disease. Your doctor will consider your individual circumstances and risk factors when determining the appropriate treatment for your blood pressure. Blood pressure can vary based on a number of factors, including stress, physical activity, and the time of day. Therefore, it's usually necessary to take multiple readings over a period of time to diagnose hypertension. Here are some tips for taking an accurate blood pressure reading. Sit in a comfortable, upright position with your feet flat on the ground and your arms supported on a table or armrest. Avoid smoking, eating, or exercising for at least 30 minutes before taking your blood pressure. Avoid drinking caffeine or alcohol for at least an hour before taking your blood pressure. Make sure the cuff is placed on your bare arm, at about the same level as your heart. Keep your arms still and relaxed while the cuff is inflated. Follow your healthcare provider's instructions for taking your blood pressure. It's also important to use a properly calibrated blood pressure monitor and to follow the manufacturer's instructions for use. If you are using a home blood pressure monitor, it's a good idea to have it checked periodically by a healthcare provider to ensure it is accurate. If you are diagnosed with hypertension, your doctor will work with you to develop a treatment plan. This may include lifestyle changes, such as eating a healthy diet, exercising regularly, and avoiding tobacco and excessive alcohol consumption. Your doctor may also prescribe medication to help control your blood pressure. It's important to follow your doctor's instructions and regularly monitor your blood pressure to ensure it stays within a healthy range. There are several types of medications that can be used to treat hypertension, including diuretics. Diuretics, also known as water pills, help remove excess salt and water from the body. This can help lower blood pressure by reducing the volume of blood in your arteries. Examples of diuretics include hydrochlorothiazide and indapamide. ACE inhibitors. ACE inhibitors work by blocking the production of a chemical called angiotensin II, which can cause blood vessels to narrow. This can help lower blood pressure by relaxing the blood vessels and allowing blood to flow more easily. Examples of ACE inhibitors include lisinopril and enalapril. ARBs or angiotensin receptor blockers work by blocking the action of angiotensin II on blood vessels. This can help lower blood pressure by relaxing the blood vessels and allowing blood to flow more easily. Examples of ARBs include losartan and valsartan. Beta blockers. Beta blockers work by blocking the effects of certain hormones that can cause blood vessels to narrow. This can help lower blood pressure by relaxing the blood vessels and allowing blood to flow more easily. Examples of beta blockers include atenolol and bisoprolol. Calcium channel blockers. Calcium channel blockers work by blocking the flow of calcium into cells in the heart and blood vessels. This can help lower blood pressure by relaxing the blood vessels and allowing blood to flow more easily. Examples of calcium channel blockers include amlodipine and nifedipine. Alpha blockers. Alpha blockers work by blocking the effects of certain hormones that can cause blood vessels to narrow. This can help lower blood pressure by relaxing the blood vessels and allowing blood to flow more easily. Examples of alpha blockers include doxazosin and prazosin. It's important to note that these medications can have side effects. Common side effects of hypertension medications include dizziness, lightheadedness, and headache. Some medications may also cause gastrointestinal side effects, such as nausea and diarrhea. It's important to talk to your doctor about any side effects you experience while taking blood pressure medication. If you are experiencing severe or persistent side effects, your doctor may need to adjust your treatment plan. So, that's a quick overview of hypertension. If you have any questions or concerns about your blood pressure, be sure to talk to your healthcare provider. Please also tell us what you think of this video, and if there are other topics you would like us to cover, by commenting below. Thanks for watching.